doctors at Aunon Dental Group are leaders in the field of cosmetic and restorative dentistry. They have served Northern Virginia since 1988, and they stay at the cutting edge of technology and its advancements in dentistry. Here to tell us more about their state-of-the-art practice is Dr. Jose Aunon himself. Welcome.
Thank you for having me.
To Let's Talk Live. Tell me about cosmetic dentistry. I think a lot of people are worried about the pain, what's it going to feel like, and the drilling sound, but what makes your practice so different?
Cosmetic dentistry, there's a lot of things to offer in dentistry as far as a lot of technology that's available. For example, CEREC technology is something where we can prep a crown at the visit, and we can also send it to a milling unit and make the crown at the same appointment. So basically you leave that day with a crown. It takes about 15-20 minutes to get it milled, and also to polish it, and also to potentially, if you have to put it in the oven and bake it a little bit longer, it takes a little bit longer to do.
So this is like instant gratification. If you've got a pain, you go in and it's taken care of.
If you need a crown, yes, it could be taken care of at the same day, and you leave with the crown that day, so you don't have to have another appointment to come back, and you don't have to deal with having sometimes it can be very uncomfortable to have a temporary crown for dealing with 2 or 3 weeks till it gets back from the lab. So basically you come for a crown, you leave the same day with it.
That's great. Why did you get into dentistry?
We have a lot of friends in the family who were growing up were dentists and doctors, and they always talked about how I always listened, eavesdrops in the conversations on how they were able to help people and get them out of pain, and I thought, oh, that would be so cool if I could do that someday. I also liked to tinker when I was younger, so I'd always take things apart, try to put them back together, and sometimes I was successful, sometimes I wasn't, sometimes I got into a lot of trouble when I was...
And so you've channeled that for good now.
I've channeled it for good. I was able to, once I figured out that dentists were able to use a lot of instruments and tools on a daily basis, I figured that was a match made in heaven for me.
So now you work with a lot of lasers now too. I mean, if you're into technology and tinkering,
yes,
working with that must be so gratifying.
It's been a lot of fun. There's a lot of great technology in dentistry today. So technology is there for making it easier for the doctor, the dentist, to do his work, and also it's there for making it easier for the patient to get treatment without being so stressful. For example, lasers. I've had lasers for 10 years. 80% of the time I don't have to give injections. So
really?
When patients find out that they don't need, I can do a procedure without giving them injection, they're kind of like, happy as a clam.
Right.
Any day that I can, cut back on the number of injections I give in my office is always a great day for me and also my patients as far as stress-wise.
So tell me what the laser does. Is this in lieu of drills? How does the laser work?
Yes, it's basically like taking bites out of the tooth.
Oh, okay.
So when you have the loops on, you can it's actually pretty cool to see. It just takes in little nibbles, and the effect of the laser on the tooth is it cools the tooth down so the patient doesn't feel it. So it's like clapping your hands 100 times. You get a tingling sensation. That's the effect that the laser has on the tooth. So it's pretty cool.
And you work with the lasers. We can see video of you actually doing this in your practice. This is what you use mostly for cavities? What is the laser
a lot for cavities, a lot for soft tissue procedures. For example, kids, 90% of the kids, I don't numb them up to do fillings. So parents mothers especially, are very happy when they're able to, their son or daughter have a procedure and kind of leave like nothing was done. And you used to work at the Pittsburgh Children's Hospital. Is that where these lasers sort of first started being used? No, lasers is no. Children's Hospital was a residency after I finished my dental school. It was basically Children's Hospital was like condensing 10 years of education into 2 years. So it was a great experience. We were in the operating room a lot. We were responsible for covering the emergency room every third night. So we did a lot of trauma as far as dealing with car accidents, bone fractures, emergency surgery. A lot of emergency stuff. Okay, so tell me if I have a situation, it's like, tell me. So I have this friend, okay, it's me. If I've got a cavity that's like getting a little close to probably needing a root canal, but it's fine for now, is this something that a laser could pretty much work on? And I shouldn't wait? Yes, it could. I wouldn't wait till it hurts too much, because then we're dealing with other things. But yes, a laser could definitely help you in that scenario. Where can folks find out more information, get a consultation with you? Give me a call at the office, 703-266-2483, or call VirginiaLaserDental.com. And where are you located? In Centerville, Virginia. Great. Well, you're centrally located. Thank you. Thank you so much. Thank you for having me. Well, Let's Talk Live is coming up. Stick with us right here.